Hello, everyone. I'm Dr. Aditi Joshi. I'm excited to present a series of speakers from our Voices of Innovation European Edition. This series looks at a number of innovations that are happening in digital health, healthcare, and hospital systems throughout Europe. And today, I'm really excited to have one of the authors of one of the chapters in our book, Anniina Mustikkamaa from Finland, who is going to tell us about her project and what she sees about innovation in Europe. Nice to have you, Anniina. How are you?
I'm doing great. Thank you so much for having me.
Great. So let's get into it. So tell us a little bit about yourself.
Yes, so I am originally a paramedic and a registered nurse. I worked a lot in acute care for a short period of time, and then I switched to the admin side and did a master's in public management, and have been working in health tech for quite a while, in on the implementation side especially. And my current job is doing change management as a project manager at a public health and social care organization in Finland. It's a geographic region that we take care of. And in particular, we've built a change management team specifically for the implementation of a health and social care platform that can be used by the people living in our area as part of their public health and social care services. So that's been a very exciting project and something that we really wanted to launch quickly. And we've been happy to learn that a really big part of the people living in that region have already started using it. So far, it's been quite successful. But of course, we're always aiming for more users and more services that we want to provide, and also aiming for higher satisfaction within professionals too, of course.
Population.
Absolutely. We recognize that. So I talk a lot about health and social care because our organization takes care of both. But of course, in many countries that's more separate. But for us, we recognize that healthcare professionals, they are bombarded with change. I'm sure that we're not the only organization who faces that. There's a lot for them to take in. And because of what the sort of the implementation that we wanted to do for this platform was a really strategically important one for us. We wanted to make sure that the change management is adequately taken care of and staffed. So we built an entire team out of people who were already working in the organization. So a lot of them are, for example, nurses, physiotherapists, they might be working in social care. So we took them and built a team from people who already understand how our organization works, know people, they have networks, they understand the day-to-day. And these people really became the face of change. So we made them responsible for a certain part of the organization to help them do goal setting, do introductions of what's coming up, and then do the training, do go live support, walk them through the whole process from the very beginning to constant improvements, further implementations, just expanding the services. So we really wanted to make sure that the people, both managers in the organization, but also just any person, anyone working in the organization would know who to contact and have a face to the change, and feel supported all through the way, instead of having people who specialize in training, and then some people specialize in data, some people specialize in go live support. So we didn't want to do that. We wanted to make sure that we have a stream of things that these people can take care of
Mhm.
and really walk along the way of the change to make sure that we implement something that will stick and that will be also found that the professionals will find that useful for them and will enjoy using it instead of being intimidated by that change. So walking along the change is really what we wanted to do.
I think this is so important. Change management is one of the things that really is a barrier to successful technology adoption, successful health adoption. And I don't want to give everything away in your chapter. Everyone should go and read it. But I do want to think about this in the broader context of Europe. How do you see the lessons that you've learned being applicable to Europe, or working at the intersection of innovation healthcare systems around Europe as well?
a lot of the challenges that we face in implementation and change management are very applicable to, I would even say, globally. I don't think there's that much, people are people everywhere, and people have, a lot of healthcare, especially in public healthcare, a lot of organizations are not very well resourced. And that also adds to the challenge of change management because people feel like they're already struggling getting their regular work done. And then on top of that, you need to take something new into use. And I understand that it's stressful. And I think that's quite universal. I would say a lot of organizations, at least in healthcare and even outside healthcare. So just the resourcing, kind of the communication, the adequate training, making sure that people have time to put into learning things and really trying things out, useful to a lot of organizations.
Thank you, Anina. I think that's a really great lesson because it tells you that sometimes the things are not easy to do, but the results and the outcomes can have a lot of impact. Her book will be coming out in May. You can read Anina and Robbie Harlow, her co author, talking about their project in Finland and change management and a whole lot of other stories from around Europe and their innovation. Thank you so much for joining me, Anina. It was really nice to have you, and I can't wait for everyone to read about your project.
Thank you so much.